What is herd immunity,
also
and how
known
does
as
it
community
work?
immunity, occurs when a significant portion of a population becomes immune to an infectious disease, reducing its spread. This can happen through natural infection or vaccination. When enough people are immune, it creates indirect protection for those who are not immune, helping to control outbreaks and protect vulnerable populations. Understanding herd immunity. Herd immunity works by breaking the chain of infection. If a large number of individuals are immune, it becomes difficult for the disease to spread because there are fewer susceptible hosts. This threshold for herd immunity varies depending on the disease's contagiousness, known as the basic reproduction number, or R0. For highly contagious diseases like measles, about 95% of the population needs to be immune to achieve herd immunity. Achieving herd immunity through vaccination. Vaccination is the safest and most effective way to achieve herd immunity without causing widespread illness and death. Vaccines stimulate the immune system to develop protection against the disease without experiencing the actual illness. Widespread immunization campaigns can significantly reduce the incidence of diseases such as polio, measles, and whooping cough. Natural infection and herd immunity. Herd immunity can also occur through natural infection, where people become immune after recovering from the disease. However, this approach can lead to high rates of morbidity and mortality. For example, attempting to achieve herd immunity through natural infection for COVID-19 would result in a substantial number of severe cases and deaths, overwhelming healthcare systems. Benefits of herd immunity. One of the primary benefits of herd immunity is the protection of individuals who cannot be vaccinated, such as those with weakened immune systems, allergies to vaccine components, or very young infants. Herd immunity reduces the spread of the disease in the community, thereby protecting these vulnerable groups. Challenges in achieving herd immunity. Achieving herd immunity can be challenging due to factors such as vaccine hesitancy, unequal access to vaccines, and mutations in pathogens that might reduce vaccine effectiveness. Additionally, some diseases require very high immunization rates, which can be difficult to maintain over time due to logistical and social factors. COVID-19 and herd immunity. The COVID-19 pandemic has highlighted both the importance and challenges of achieving herd immunity. Vaccines have played a crucial role in controlling the spread of the virus, but factors such as vaccine hesitancy, the emergence of new variants, and global disparities in vaccine distribution have complicated efforts. Public health strategies continue to emphasize vaccination, booster doses, and other preventive measures to manage the pandemic. Long-term implications. Long-term, achieving and maintaining herd immunity requires ongoing public health efforts, including vaccination campaigns, surveillance, and addressing vaccine misinformation. Continuous monitoring and adaptation to new challenges, such as evolving pathogens and changes in population immunity levels, are essential for sustained protection. Herd immunity is a critical concept in public health, providing indirect protection to vulnerable populations and reducing the overall spread of infectious diseases. Achieving herd immunity primarily through vaccination is safer and more effective than through natural infection. Ongoing public health efforts are essential to overcome challenges and ensure high immunization coverage, ultimately safeguarding communities from outbreaks and epidemics.